You're listening to an IOE podcast.
Powered by UCL Minds.
This is Research for the Real World. Conversations with researchers about the paths they've taken to shape our everyday lives.
This is Research for the Real World. Hi, I'm Emily McLeod and I'm a PhD researcher at IOE, UCL's Faculty of Education and Society. In this season of Research for the Real World, we're getting involved in IOE's 120th anniversary celebrations. So we're shining a light on the contribution that IOE postgraduate researchers, past and present, make to society through their work. This is also a momentous occasion for those involved with the EdD programme as it celebrates its 25th year. In this episode, I'm delighted to be talking to Dr. Georgia Pavlopoulou. Georgia is a lecturer in IOE's Department of Psychology and Human Development, and she has almost 20 years of experience working with autistic people and their families in education and healthcare settings. Georgia did her PhD here at UCL, which looked at the relationships between autistic and non-autistic siblings. Since finishing her PhD in 2019, Georgia went on to conduct research on personalised care in sleep management and anxiety with autistic teenagers, and sleep research priorities of autistic adults. Her work has a strong participatory element, and Georgia has worked to co-produce research with community members to ensure that its impact reaches beyond academia, which is what this podcast is all about. For this, Georgia has won the One UCL Award for Community Spirit, and earlier this year, she received an IOE Early Career Impact Fellowship, which she'll be using to co-produce materials with mental health practitioners and autistic young people. I look forward to hearing more about that work, Georgia. Welcome to the podcast.
Thank you so much for having me.
It's great to meet you, Georgia. So, sounds like it's been a really busy couple of years for you. But before I ask more about your work now, it would be great to get to know a bit more about you. So, can you start by telling our listeners a bit more about your own background and your own education and how you came to be where you are now?
Thank you so much for that opportunity. So I started with a background in being trained as a teacher. I have worked in the past 19, almost 20 years now in both educational and clinical services. From teaching, I jumped into psychology and mental health, and then psychotherapy and counseling. I have been involved in educational and clinical services, working with people with neurodevelopmental conditions, and I have experienced the opportunities and challenges to put people at the heart of what we do in clinical and educational practice. Thinking about my research is impossible not to think of my professional journey. The community I serve in practice and my past informs my research questions and is pushing me to become the change I want to see in the world. So I started with a degree in education and social sciences, then I moved into psychology and special needs, and later on into mental health counseling and psychotherapy. I started after my undergrads. I worked as a research assistant in Greece, working on 12 case studies of disabled children who were at risk of school exclusion. And unfortunately, some of them today have suffered preventable and premature deaths. And that made me think, what is the narrative we hold as professionals when working with children with co-occurring conditions? What makes life impossible for these people and their families? Why we fail to facilitate happy and healthy lives for people with disabilities? It created a lot of questions for me. How are we supporting people to live their life in their preferred ways? Do we aim to fix them, or do we try to normalize them and to fit them into our neurotypical boxes? As I developed my practice in different schools and mental health units, there was a great question becoming bigger and bigger for me. Who is deciding about what autistic people can or cannot do? How do we assume ability or disability? When I became a scientific director in a mental health unit in Greece that was specialized for autistic children and their families, I moved from child-centered approaches, working directly with children, into more family-centered approaches, thinking about the whole family. This is when I realized how little I knew about what is it like for parents or siblings. In particular, at that point, many parents were talking to me, telling me about the other child, the non-autistic child in the family, and how much advice they needed about their worries and how to handle the dynamics of the siblings and how to best support both siblings, autistic and non-autistic. And I realized that I don't know much about it. So I started traveling in the UK, attending different seminars, connecting with SIBS charity here in the UK. And then I decided, wow, that's a whole new world for me now. This is what my PhD is going to be about. I'm going to look at autistic and non-autistic siblings' experiences. It wasn't exactly like that in the beginning. In the beginning, I made an assumption that siblings need support, siblings need intervention, and so I'm going to design a brand new intervention. And then I stepped back and I was like, but what do I know about siblings' lives? So that took me into that journey for a few years during my PhD studies to look at autistic and non-autistic siblings' experiences. And as soon as I started studying for my PhD, I noticed a paradox. When we look at neuroscience, at statistics, or read at the headlines of big charities and in the news how autistic people and the family members are presented, they're always presented as being at risk, as living in a household chaos, as being at risk for developing different conditions or being lonely. And then the families I knew, they were all advocating for happier and healthier lives. They were feeling lots of feelings of love. They were advocating for a better society. They were strong people, some of them carers. And I noticed that there is a big paradox here. So, who is holding that narrative? How do we talk about people with disabilities and their family members?
That's so interesting to hear how your own background and career before joining academia kind of informed your PhD research. Would you mind telling our listeners a bit more about some of the findings from your PhD and those relationships between autistic and non-autistic siblings?
So, my PhD gave me the opportunity to develop a framework looking at autistic people and their family members in both agency and vulnerability places. That means that autistic people's experiences allow them to be in a position of making decisions, good decisions about themselves. So there was a mix of experiences, a wealth of experiences that was recorded by siblings themselves. Siblings spoke a lot about a tsunami of feelings, lots of feelings of love, lots of feelings of guilt when there is conflict. They spoke about how they support each other. Siblings, in particular, non-autistic siblings, spoke about how much they would like society to care more about their family needs and how much they appreciate holistic approaches when it comes to family care. At the same time, non-autistic siblings, and that's a voice that we rarely hear in siblings research. So non-autistic siblings, they mentioned about how much they love and they appreciate their family members. They spoke about the joys as well as the difficulties of siblinghood experiences. And all these experiences were communicated by members of the local community in Greece. What was unique in my experience working with siblings is that I elicited their experiences, perspectives, and needs through participatory research. That means that I didn't set up an agenda. I didn't come up with my own methodology, but I invited siblings from the community to work with me on defining what's the best way for me to understand your experiences, and also what is the best way for all of us to share these experiences with your teachers, with the therapists of your brothers and sisters, with the people who work with your families, so that your local society can understand your experiences, perspectives, and needs.
Actually, you're really reminding me of a TV program on Netflix I've seen recently called Atypical, and it's about that family dynamic of one sibling with autism and one sibling without autism, and yeah, the positives of daily life as well as some of the challenges that they face together. I really appreciated you sharing at the start that your PhD plan kind of changed when you kind of got out into the field, because I'm aware in my own PhD sometimes things have to adapt and change, and that's something as researchers that we have to kind of just get used to, and we have to be adaptable. So thank you for sharing that first of all. But because I'm in my kind of final year or so of my own PhD, I'm also really interested in how you found that transition from being a student relatively recently and then kind of doing your own research project there to becoming a researcher and an award-winning researcher, working in a bigger team and also teaching others. So how have you found that transition?
Yeah, that's a great question. Well, you have to be brave and to embrace changes and to always be brave, I guess, to learn something new. Every collaboration, every project is teaching new things, is presenting with new challenges. I think for me, one of the key points was when I started working actively with the community, which started very quite early on in my PhD due to the participatory nature of my project. So working with experts by experience taught me a lot about how to be humble, how to respect different people's opinions, and how to adopt a mindset which is much more important than the set of skills that I would develop later on. In my case, it was all about to develop a mindset that would allow me to learn from people. So I think I started from that. And that helped me a lot to frame qualitative research and and creative storytelling, and then play with different methodologies. I think UCL as well offered a number of opportunities for me, and it does offer for all students. IOE offers a number of research and engagement small grants. I applied for many of them and I got many of them. And each one of them presented me with a unique opportunity to meet people, to learn how to communicate my research, my aims, my objectives, to learn from people different methodologies, to work with people rather than on people in my projects, and to communicate my results and the evidence of my work into the community in ways that communities then can adapt and can make use of the evidence base that I was creating. The community also comes up with great points of criticism and great feedback that can make your work much, much stronger. I think another key point for me, it was to make sure that I love what I'm doing, so that I can work long hours and I can battle with that feeling of being imposter, of being early career. I think gradually focusing on what really sets our soul on fire, having a very clear set of values in our research, and being connected again with the community that we're serving has been very, very important for me. So I think loving my job and loving my field has really helped me to move on.
Yeah, oh, absolutely. I always feel that we're so lucky as researchers to be able to, yeah, conduct research into something that we're really passionate and interested in, because I'm aware that not all jobs have that benefit, and we're really privileged to be able to do stuff that we love. And also great to hear that link with people and that strong network that you have, because definitely whenever I get to meet new people like yourself, there's always something to be learned. So thank you. So, Georgia, I can see that you're really passionate about not just researching people, but working with them. Can you tell us a bit more about how you base your research in community settings and how you co-produce work with people with autism and their families and healthcare professionals, and why that's important to you?
A thread across every piece of work I have done so far is co-produced and co-delivered with autistic people and their family members, and is evidence-based data on what matters to autistic people and their family members, which may help clinical or educational practice to move away from the current dominant behavioral approaches that see autistic people as having deficits or as a set of deficits. So my studies are guided by a humanizing value framework with a dedicated focus on qualitative research. My work has a neurodiversity ethos that is very much looking at the experiences of people. One of the ways that I apply this into everyday practice working with communities is co-creating and co-delivering mental health trainings. So, for instance, at the moment, I'm working with Anna Freud Center at Autism and 30 autistic people in order to support those who are supporting autistic people in inpatient units. We know that for many autistic people, inpatient mental health units are unsuitable and very often traumatic places. We also know that many people end up in inpatient units because they don't have community support. Being inside an inpatient mental health unit may exacerbate or increase the difficulties that autistic people are experiencing. There are many reasons for this, but often the environment is distressing. The neurotypical staff experience their environment from a neurotypical way of being, so they might not understand the sensory or the communication challenges of autistic people. And the staff may lack the experience and support needed to make the adjustments required to provide support, routine that fits the needs of autistic people. So, trying to build capacity within provider organizations, I ran the Train the Trainer project, which is offering places to those who are supporting autistic people to understand and to be trained in a curriculum that is completely co-designed with autistic people and is co-delivered with autistic people. And that provides a unique overview of best practice through tuition of research evidence and the participation of experts with lived experience. If we want to see change in how currently mental health services operate, which is change is not very optional considering the premature and preventable deaths and the mental health crisis of neurodivergent people, having autistic people very actively involved in trainings that matter to them is one of the best ways to bring change in practice. So by having autistic people co-delivering and co-designing the trainings that we run in the community helps people who participate in these trainings to understand the barriers experienced by autistic people in the community, in the hospital environment, and to employ an experience-sensitive approach to become more reflective practitioners working with rather than on or for autistic people.
Absolutely. That just sounds so important. And it seems silly that feels like a new way of doing research. Yeah, but absolutely. Of course, the people that we are researching and interested in should be involved in conducting the research and should co-produce it with us. Absolutely, I really admire that ethos that you have. So this ethos that you speak about with your work has also led you to winning a UCL award for community engagement. So congratulations for that. Can you tell us a bit more about the project that ran alongside that, the Flow project?
Thank you so much. So I got this award for a piece of work that has been really, truly collective and collaborative. So I'm grateful to all autistic and non-autistic colleagues who have supported me. During the pandemic, I co-established with members of the autistic community in East London a UCL public art project which explored the relationships and well-being of autistic East Londoners during and before the pandemic. This is named Flow Unlocked, and it was really a creative autistic-led collaborative project which highlighted the importance of relationships to autistic people. I felt that in a period of time where everybody were running surveys asking people how anxious or depressed they were, it would be very important for me to focus on relationships as the forgotten foundation of mental health. But also, I very much wanted to tackle on the stigma that exists about autistic people not being social, not needing relationships, not understanding relationships. So I invited autistic people to work with me to define the ways that they wanted to record their reflections, experiences, and needs through poetry, photography, drawing, and films. We co-established as well together with autistic consultants the objectives as well as the methods of the group. So what was highlighted through this project, it was that autistic relationships are rich, are very nuanced, and are very creative when autistic people are accepted in the local communities. So that has proved to be a wonderful theme for a dynamic creative collaboration aiming to raise awareness of the social determinants of autistic mental health. So, for instance, I found out that the intense sensitivity with which autistic people relate to the world is rarely recognized, let alone celebrated. And this is what made Flow Unlocked very unique. This is why our Flow Unlocked group has been reflecting on the breadth of personal and sensory relationships that have sustained autistic people before and during the pandemic, as well as those relationships that they have missed.
And you mentioned that work was during the pandemic. So how was conducting that project online, I guess?
It was the first time for me to run community participation work online. Initially, I was even wondering, can we do all that online? Can we reach a meaningful level of feeling connected as a group and taking so much decision making and running endless hours on Zoom, of sharing poetry and photography? As well as the ambiguity of those times, we started with the plan of being face to face and then online, and there were some discussions to go back to face, which didn't happen. So we got inspiration by everything that was happening during the pandemic for our name, Flow Unlocked. Regent's Canal and Lee River were the geographical focal point for our project. The river was connecting us as well as dividing us. And we saw the rivers as a metaphorical flowing artery for our ever-changing neighborhoods. Also, the theory of flow, the flow state, is a popular theory amongst autistic thinkers as it resonates with the ability of autistic people to have extended focus and to hyper-focus on specific areas of interest. And we spend much of the shared time on Zoom listening to autistic people, listening to each other, talking about our focused interests, our passions, and our relationships with objects, places, people that give meaning during those times on the pandemic.
Thank you. That's really interesting to hear. I know that a lot of research had to be moved online quite quickly, and it sounds like you were able to do that again with your continued ethos of working with the community. And I mentioned also in the introduction that you've also recently been named an IOE Early Career Impact Fellow. So how does that work tie in with the rest of the research that you've been telling us about?
This was a fascinating experience for me. Working on the Impact Fellowship scheme allowed me to develop my previously completed work funded by the John and Lorna Wing Foundation. So I had just completed a project working with autistic teenagers, learning about their sleeps, employing a very sensitive, experience-sensitive framework. So my study originally employed a personalized approach into collecting, categorizing, coding, and analyzing qualitative data. This allowed the autistic teenagers and myself to work together across key stages of data collection, data analysis, and come up with ideas that very much fit the priorities of autistic people in terms of managing their sleep. The momentum that was created at an individual level during each of the interviews I conducted with teenagers continued at a community level. So, with the Impact Fellowship scheme, I had the opportunity to work with autistic teenagers in Kent, along with NHS emotional wellbeing practitioners. We co-established a group to respond to the action items that I had identified in my research with autistic teenagers. And we also had a chance to spread the message that it is important to work out what works for each autistic young person, even if that is different from the general sleep hygiene rules. We have a number of launch events based on the material that autistic teenagers in Kent and their clinicians and teachers co-created. Through the Impact Fellowship scheme, I've learned on how to push my own boundaries in terms of participatory research. So this time, I didn't play any role in decision making. My role was to facilitate a safe space for clinicians, teachers, and autistic people to come together with autistic teenagers leading that space, really, deciding of how they want to work with animators, scientists, and their teachers and clinicians in order to create novel digital material to help people in the community as well as other autistic teenagers what might help for a good night of sleep.
Oh, fantastic. And is that digital material available online now?
It's going to be available through UCL Discovery as well as from the emotional wellbeing team at Kent through the NHS page.
Fantastic. And before we go, Georgia, it sounds like it's been such a busy few years since the pandemic and since finishing your PhD for you. So what's next? Do you have any new projects coming up?
Yes, so currently I have just been awarded as a co-investigator with colleagues from King's College, Anna Freud Center and IOE on a project funded by Medical Research Council and Developing Mind, looking at prevention of depression in neurodivergent young people aged between 11 and 16 who may have a diagnosis of autism, ADHD, or both. This is a very interdisciplinary and multidisciplinary project that brings together psychologists, educationalists, neuroscientists, psychiatrists to work together to find best ways on how to collaborate with autistic teenagers or teenagers with ADHD, on how to best understand issues around emotional regulation, consider of best ways of preventing depression through working on emotional regulation and the role of school. School is a place of full of opportunities as well as challenges for young people. And that place is school as a perfect context for us to consider what can we do to prevent depression for this population.
Of course. Yeah, that sounds very timely and really interesting. I look forward to hearing more about that in the future. Thanks so much, Georgia. It's been really interesting hearing about your career and your research, but I've particularly enjoyed learning about how you work with and not just to people with autism and their families, and how you co-produce practical materials for use with autistic people and the community. So thank you. Thank you for coming on the podcast.
Thank you so much. I think sometimes, or most of the times, it saves time, money, energy working with people because you can understand their priorities and then you can address their priorities. So, from a scientific perspective, we have more chances to get it right and to have more robust research if we work in a collaborative way with the people that we aim to serve. On a more personal level, I think it has completely enriched my relationships, the way I understand the world, the way I connect with others, the way I connect with neurodivergent people. When projects are collaborative, people are kind, bring all the good qualities in the front, want to be helpful. People learn how to respect each other, and I feel that working with the community, we all grow towards the direction that we would like things to grow.
Of course, yeah, we all learn from each other. You can follow Georgia on Twitter at UCL_grand with 2 R's and at Joe Pavlopoulou. That's JOPAVLOPOULOU to learn more about her research. Some of what we've covered today is also available in the episode notes. If you've enjoyed this episode and want to find out more, we have our archive of 14 past seasons available for you to listen to. Search IOE Podcast from wherever you get your podcasts to find episodes of Research for the Real World, as well as more podcasts from the IOE. I'm Emily, thanks for listening.
Research for the Real World is produced by IOE Marketing and Communications and IOE Research Development. The theme music was created by Rob Cochran. Tatiana Sotero Diaz is the series advisor, Amy Leibowitz is the series producer, and Jason Ilagan is the executive producer of the IOE podcast.
Thanks so much for downloading and listening to this IOE podcast.